The vaccine alliance, known as Gavi, which is basically just Bill Gates' vaccine uptake pet project, has Canada listed as its board member. And today we're going to look at who the unelected bureaucrat is that represents our country at Gavi and just how much taxpayer dollars she has directed to global vaccine uptake efforts. Did you know that Canada is a Gavi Alliance board member? That's right, the global authority on pressuring vaccines on the global world scale, especially third world countries, under the guise of equitable access, has Canada in its financial back pocket. This first came about in an order paper question, an OPQ, in the House of Commons late last year by Member of Parliament McPherson in Edmonton, Strathcona. MP McPherson was asking for negotiation participation notes on the government's position on the World Health Organization's pandemic treaty. Global Affairs Canada responded that it continues to support access to COVID-19 vaccines and medical countermeasures globally through its $2.1 billion contribution to the ACT Accelerator, and that it continues to work with countries and global partners to strengthen immunization delivery systems, integrate COVID-19 management into routine health services, and reinforce broader health systems. That's $2.5 billion of Canadian taxpayers' hard-earned money being given to a World Health Organization initiative intent on supporting the development and equitable distribution of the tests, treatments, and vaccines the world needs to reduce mortality and severe disease, restoring full societal and economic activity globally in the near term, and facilitating high-level control of COVID-19 disease in the medium term. ACT stands for Access to COVID-19 Tools, that's ACT obviously, and its accelerator is intended as a groundbreaking global collaboration to accelerate development, production, and equitable access to COVID-19 tests, treatments, and of course vaccines. It was launched at the end of April 2020 at an event co-hosted by the Director General of the World Health Organization, the President of France, the President of the European Commission, and there it is, the Bill and Melinda Gates Foundation, with the intention of bringing together governments, scientists, businesses, civil society, and philanthropists and global health organizations like, there it is again, the Bill and Melinda Gates Foundation, CEPI, the Coalition for Epidemic Preparedness Innovations, FIND, a Global Diagnostic Alliance, Gavi, the Vaccine Alliance, the Global Fund, UNITAID, Wellcome Trust, the WHO, and the World Bank. Following the ACT Accelerator launch, UNICEF and PAHO became delivery partners for COVAX, which is the vaccine pillar. You can see all of their partners on the infographic further down on the About page, including the WHO, who is playing a key role in all four pillars, as well as leading the cross-cutting access and allocation workstream to ensure, once again, equitable allocation of COVID-19 tools. It's also said that the ACT Accelerator launched its transition plan in October of 2022, setting out adjustments to its way of working as countries move from managing COVID-19 as an acute emergency to integration into longer-term disease control programs. According to the transition plan document, COVAX, which is the COVID Vaccine Global Access Initiative, said it will incentivize further innovation on COVID-19 vaccines, especially with potential need to include them in routine programs going forward. On page 36, under Risk Communication and Community Engagement, RCCE, they say that they will leverage communities and other in-country stakeholders to combat misinformation and create demand for COVID-19 tools. And our government is supporting this not only through that $2.1 billion contribution, but also by being a board member on Bill Gates' Global Vaccine Alliance, Gavi. The order paper response says, as a Gavi Alliance board member, Canada remains engaged in Gavi's efforts to support increased vaccine manufacturing in places like Africa. Unelected and unaccountable bureaucrat by the name of Melissa Hisco is our Canadian Gavi board member. She's the Director of Global Immunization and Health Systems at Global Affairs Canada. She was also the previous director of Canada's COVID-19 Global Health Task Force, managing international aid commitments and investments to combat COVID-19 on a global scale, despite the fact that she has no medical training. Instead, Hisco holds a Bachelor of Arts from Carleton University and a law degree from the University of Ottawa. Contained also in the order paper response is funding above and beyond that $2.1 billion, which seems like Hisco is the person who directs. There's the Canada's Global Initiative for Vaccine Equity, CanGive, which received $317 million, includes funding to strengthen vaccine delivery systems, integrate COVID-19 vaccination, and reinforce immunization and primary health care as avenues for enhanced vaccine equity. Canada increased funding to mRNA technology transfer and manufacturing hub in South Africa for a total contribution of $45 million. They also provided $15 million to the Pan American Health Organization, PAHO's COVID-19 mRNA vaccine manufacturing platform to strengthen vaccine production and regulatory capacities in Latin America and the Caribbean. Canada is also providing $100 million over 5 years to the Coalition for Epidemic Preparedness Innovations, I mentioned before, CEPI, to accelerate the development of vaccines against emerging infectious diseases. CEPI was also criticized in an article by The Lancet for a lack of transparency in its grant agreements after the Vaccine Development Assistance Agency received $1.4 billion in public money to accelerate COVID-19 vaccine research. Further to that, according to a February 2023 letter from then Health Minister Yves Duclos, Canada has committed close to $3.5 billion in international assistance in response to the COVID-19 pandemic. Did Canadians ever have a say in this process, in these allocations of funds, millions and billions of their dollars? These are questionable priorities by the Liberal government, which supports global vaccine efforts despite the growing domestic financial struggles faced here at home by everyday Canadians amid a housing and cost of living crisis. With unelected bureaucrat Melissa Hisco, who lacks any sort of medical expertise or training, directing these funds, the lack of transparency in the various World Health Organization's initiatives raises concerns about how much public input was received before decisions were made and how much democratic process was involved in ensuring fiscal responsibility of our government with these funds. For Rebel News, I'm Tamara Ugolini. Canada seems to have put all of its eggs into one basket with the mitigation measure known as the COVID-19 mRNA injections. And if you'd like to check out real reporting on the safety and efficacy of those products and find accurate, up-to-date information, then please visit our website at nomoreshots.ca. There you can sign our petition and also send an email to Health Minister Mark Holland calling on him to revoke market authorization of these rushed novel biologics and support our journalism while you're there if you can. That's nomoreshots.ca.